Depression often clusters in families. Mikhaila Peterson and her father, Jordan Peterson, are from such a family. Both have struggled with depression for much of their lives. We spoke to them about that in 2012, and 4 years later, we welcome them back. Mikhaila and Jordan Peterson here to tell us about experimenting with diet as a way to manage depression. And we're delighted to see you two back here in this studio.
Still alive.
Still alive, still going strong. Jordan, how do I put this delicately? Get comfortable. I'm going to ignore you for the next several minutes because I want to talk to your daughter.
Absolutely fine.
Here we go. You want to see what you looked like 4 years ago?
I guess so, yeah.
I think you're going to have to. Sheldon, if you would, roll the clip. But Mikhaila, as you see this family history unfold, you see a grandfather, I guess your great-grandfather, who was basically, I guess, incapacitated by his depression at a certain point. And now we look at you, who are university students and, by all accounts, doing great. There has been a progress over the years. Does that give you some satisfaction?
Yeah, I really don't know how I'm on antidepressants now, and I don't know how anybody in my family would have really survived without them.
So taking those medications means that you can do what, as opposed to when you were off them, you couldn't do what?
I smile a lot more, I laugh a lot more, and I don't sleep as much as I would.
Now, do you take anything for your depression?
Like, the depression in our family happens to be extremely severe, and sometimes that requires the use of more than one medication. And so I take a serotonin reuptake inhibitor, which is
SSRI.
Yes, it's like Prozac. I don't take Prozac, but it's similar to that. And I also take a drug called Wellbutrin. And Wellbutrin, in many ways, is a safer drug, and its primary purpose is to increase positive emotion rather than decreasing negative emotion.
Okay, how old are you now, incidentally?
24.
You're 24 now. How are you?
Great, I'm really good.
Why are you really good?
I started looking into diet for other reasons, not the depression. I thought the depression was here forever. And surprisingly, the depression lifted in like November for the first time ever.
This past November?
Yeah.
Because you changed your diet?
Yeah.
We got to look into that a little more.
Yeah.
What kinds of things were you, first of all, were you on any kind of diet before, or was it eat whatever you want type of thing?
It was eat whatever I want.
So what did you change?
Well, I cut gluten out in May, and I cut it out because I was having other health problems. It wasn't for the depression. And I cut that out in May, and I was feeling a little bit better. And in September, I went on an elimination diet. So I went down to like chicken and beef and green vegetables pretty much for about a month. And the other health problems I was trying to figure out got better. So I stayed on that diet, and I started introducing foods really slowly. And in mid-October, I started getting side effects from the antidepressants. So that's just like weird hand feelings and like kind of sweating more than you should. And so I cut the antidepressants down in half, which was really shocking because I used to be able to go down on them a little bit in the summertime, but in the winter it was like, it just got worse and worse and worse until like February. So October isn't a good time to like cut your antidepressants half. So I cut them in half, and that went fine. It went well, I was happy.
It's not supposed to, but it did.
Yeah, I've never been able to do that. I've been on them since I was 12, and I've never felt like that. So I was like, well, that's strange. Like, maybe it's the diet, or maybe, I don't know. I didn't know what was going on. And then in mid-November, I went down a little bit more, and then I stopped taking them, and I felt like fantastic. And
hang on, you stopped taking them entirely?
Yeah.
You are off antidepressants now?
I'm off medication, yeah.
Entirely?
Entirely.
For the first time in?
Since I was 12
years.
Mm-hmm.
And for her arthritis.
Yeah.
No medication.
So everything, not just for the depression, but for all of the other health effects as well.
Yep.
So you've gotten rid of a lot of stuff in your diet, you're off meds entirely, and you feel good.
I feel fantastic. I've never felt like this before.
How do you explain this?
Well, see, I guess the main question is, well, what if it was just a coincidence and the depression lifted and it had nothing to do with the diet? But because Dad was fairly skeptical, which is fair enough. I was skeptical. I didn't think that diet had anything to do with. When people told me that I should exercise more or fix my diet, I was insulted. But I mean, it wasn't fixing my diet that was the issue. There were foods that I think I'm allergic to. And the reason I'm sure it's food, it's because in December I reintroduced soy, and I really like soy. I used to put soy sauce on everything. So I had like miso soup with tofu, with edamame beans covered in soy sauce, and I had like the worst reaction from it. I had like digestive problems in about half an hour, and then the next morning I woke up, so I was like, well, that sucks. So I woke up and I was on Facebook, and there was something sad on Facebook, and I just like bawled. I was like, well, sometimes there are sad things on Facebook, but
you shouldn't have had that much of a reaction.
No, and by that night I just knew the depression. It just came back in like 12 hours, and it was back, and it was worse than I'd ever experienced it because I wasn't on antidepressants. Mm-hmm. It just came back and it just hit me, and it lasted.
Think it was the soy?
It was definitely the soy. Nothing changed in my life, and it was so dramatic. Like I didn't stop crying for like 5 or 6 days. Like I went out to eat with Julian and Dad and Mom at a French restaurant, and I got in and just trying to talk about it, and I cried. Like, and then the next day it got worse, and my brother drove me home. And when I was a kid, I used to have problems like being really scared. Lots of kids are scared of things in the dark. And I used to see faces kind of coming out of the shadows, or, seeing things in the dark. And Julian dropped me off at my apartment.
Julian's your brother?
Julian's my brother, yeah. Dropped me off at my apartment, and I turned around to look at him, and his face looked like a monster. It was the scariest. It was really, really horrifying. And I went upstairs and was just like, oh my God, I'm freaking out. I haven't had that happen to me since I was like a 10-year-old or 11 or 12 or something. And that misery lasted for a month.
Oh my God.
And then it went away. And that's never, the reason I never attributed it to diet before was because the depression never lifted. It was always there.
But
before.
It did pass over, after a month it was passed.
It was a month, but it was a month of waking up in the morning and crying.
Oh my.
Yeah, it was horrifying. And then it went away.
And it's been gone since.
At this time, she was also sleeping 16 or 17 hours a day. Now, Michaela's had extreme fatigue, like terrible extreme fatigue for years. And so, say what happened about that. She was taking Adderall in the morning to wake up so that she could go to school. So,
yeah, it wasn't just when the depression lifted, let's say, so in October when I went down on my antidepressants, and in November when I stopped taking them, it wasn't just that something was gone. I was actually I thought that not being depressed meant you were at zero, so you weren't miserable. Mm-hmm. But I actually got happy, so I was walking down the street smiling, which I thought normal people didn't do. The irritability went away, so I didn't feel like killing everyone when I was driving, for instance. The irritability went away.
Remind me not to drive near you when I'm... Anyway.
No, it's gone. It's fine now.
Good.
But that was the first thing that went away with the depression, is the sadness, the anger, and the irritability. That went away. Then the fatigue went away, which was huge because I was always just exhausted during the day and kind of more awake at night. And so that switched. And my memory changed. I can remember, I was never able to remember lyrics to songs. I know this is like a small thing, but I was never able to remember lyrics to songs. And then about a month after the depression went away, my memory came back. It was like, I don't know if that was long-term or short-term, but I can remember lyrics to songs now.
So you feel normal now?
I guess, if this is what normal, yeah, I didn't even know what normal was, if this is normal, but it's great.
Okay, let's get a clinical psychologist in here who happens to be Dad to explain. Does any of this make sense to you?
No, not really. I mean, there is evidence that inflammation is implicated in depression. Mm-hmm. And there's more and more research on the role of diet and gut bacteria. Gut bacteria do produce neurotransmitters of various sorts. And the other thing that's very much worth saying is that there's lots of different kinds of depression, but I've always been skeptical about dietary claims because partly because if you look through the research, you can find someone that claims anything. Don't eat meat, don't eat vegetables, don't eat fruit, you know. Don't eat this, don't eat that. And, you know, to me, the whole obsession with food seems to have a pronounced neurotic flavor. But here we go. Well, I started this diet, you know, because I was watching what happened to Michaela. And I have autoimmune symptoms. I had alopecia, which is a hair loss, very focally, 30 years ago. I have this condition called peripheral uveitis, which is an inflammation of the bottom part of the eye, and it produces floaters. I have a bit of psoriasis. Those are all low-level symptoms of autoimmune disease, and there's autoimmune disease in my family.
But you started her diet?
Yep, I started her diet on December 21st. Well, a variety of weird things.
You smiled there.
So
4 years ago, you might not have smiled.
One thing that happened was that my legs started to feel strange, like kind of jumpy. And I thought, what the hell is this? I thought it was maybe like restless leg syndrome. But for 20 years, my legs have been numb from the knee to the thigh on the outside, about a 4-inch strip. It's sort of, imagine you put a piece of cardboard over your skin and then pushed on your skin through that. That's about how it felt. Now, my wife had treated that with a massage technique, and it helped. Well, one day I woke up and that was all gone. And I thought, that's weird, man. That's been 20 years. I never thought that was going anywhere. So that disappeared. So that was kind of weird. And then I lost a lot of weight and a lot of girth, more girth than weight. And so that was probably because I was experiencing a substantial amount of inflammation. And then the next thing that happened was, like, I could stay awake forever. Like, I never get sleepy. You know, I might get exhausted, but I never feel like I could go to sleep. And paradoxically, often I can sit down and just go to sleep in a second, anywhere. So it's a weird combination. But I've never been tired at night, like sleepy tired. Well, it was at night and I'd be reading something, and then all of a sudden I'd think, oh my God, I have to go to sleep, clunk. And it was like, but that's what my wife is like when she gets tired at night. It's like, it's time to go to sleep. Christ, I could stay up until 4 in the morning, no problem. And all of a sudden, bang, I was going to sleep. And I thought, well, that's pretty weird. And the floaters in my eyes disappeared. And I cut my antidepressants in half because I was starting to experience the same overdose symptoms as Michaela. So, and it's a strange feeling. It's a motor side effect. Kind of makes you want to do this, weirdly enough. It's actually a known effect. And so I cut them in half, and that was like in the winter. So.
Which you're not supposed to do.
Well, generally that would be not good. I would instantly become impossible to live with. So.
But apparently you weren't.
Well, so far so good, you know, and the physiological change is really quite remarkable.
So as a man of science, how does this how do you make sense of all of this?
Well, you know, I don't really think we know anything about anything, you know. I mean, the more you dig into something, the more you find out that people are just randomly guessing. So depression is a catch-all category, and autoimmune disease is a catch-all category, and there's all sorts of complex forms of them, you know, and so there's multiple pathways to depression, no doubt. But see, my father also has autoimmune problems. He has psoriasis quite badly. And then, as I said, it's loaded on my mother's side of the family.
But let's understand, again, clarify.
Yeah.
You have eliminated what from your diet?
Well, mostly what I'm eating right now is meat and green vegetables. I'm not eating wheat. I'm not eating dairy. I'm not eating soy.
Legumes.
Not eating legumes.
How about refined sugars?
Sugar doesn't...
Sugar hasn't seemed to be alcohol for me. Like, for me, alcohol wasn't a problem, and I was concerned alcohol was a problem. That wouldn't have been any fun. So alcohol isn't a problem, but legumes, gluten, dairy, those ones.
All gone.
Yeah.
Here's, you know, the $64,000 question, which is, this is clearly working for you. Would you recommend this to other people because you think it will work for them?
I would recommend doing an elimination diet and starting at, like, almost nothing, like green vegetables and maybe some root vegetables and meat for a month.
And see what
because
happens.
I don't think that, like, that's not going to hurt anybody. And then see how you feel.
You know, Jordan, my hunch is a lot of people are going to watch this and they're going to say, okay, I'm off the antidepressants, I'm going to the new diet, and here we go. Are you recommending that?
No, definitely not. Like I am a clinical psychologist. I'm not recommending dietary alterations to my clients. I don't know enough about it, and I'm testing things out, and I'm watching Michaela, and she's been reading like mad. I mean, she must have read 300 papers on the relationship between diet and autoimmune disorders and depression. So she's really learning about this, and I'm tentatively feeling my way. I mean, her response was so dramatic, especially the elimination of the fatigue. That was unbelievable, because literally she was sleeping 17 hours a day.
There's no chance at all that she just sort of, as they would say, quote unquote, grew out of it.
No, not a chance.
There has to be a cause and effect here, you believe?
Oh, definitely. Well, the thing is, too, the other thing, either Michaela has one thing wrong with her or she has 7 separate diseases. Well,
chances are it's one.
Yes,
that makes more sense.
Yes, exactly. And, with her arthritis, for example, she never had the rheumatoid factor. So it's called idiopathic, which means we don't know what's going on, idiopathic arthritis. And there is evidence, for example, good evidence, that if arthritic people fast, their arthritis goes away. And it comes back when they start eating. Now, we scoured the dietary literature when Michaela was ill to find out if there was a relationship between diet and her problems, and we couldn't find anything. But Michaela has found studies recently that have just been put online, older ones, showing that you can induce rheumatic symptoms in rabbits, for example, by altering their diet. And so there is a literature out there, but these things are idiosyncratic, they're individual, they're extraordinarily complex. And so, one of the things that you have to understand about Michaela's use of diet is she was religiously adherent to this. And that's very, very difficult. It means you can't go out to restaurants except with extreme care. You can't really go to other people's houses except with extreme care. You're very annoying because you sound neurotic. You're difficult to get along with because you're always complaining about food. Like, it's a pain. And the probability that people will slip is extraordinarily high.
Yeah, like 95.
Oh, yeah.
Yeah. Let's finish up on this. There is research that shows that 15% of the population of high-income countries are likely to suffer from some kind of depression during the course of their life. 15%. I've also seen studies that says it's 11% for middle or lower income countries. Is it possible, does it make professional sense to you, that the 4% difference is because of the different ways in which we eat?
Well, we're pretty fat. And you
Precisely.
got to wonder about that.
Yeah.
Like, Michaela's told me now when she walks down the street and she sees people who are grossly obese, which is a lot of people and a lot more all the time, that she, her first reaction is they should stop eating wheat. But she thinks, well, there's something wrong. There's something gone wrong, and she's also informed me that her research has indicated to her that gluten is probably a low-level toxin for everyone, but some people are more sensitive to it. And I don't know what to make of that. I mean, there's a lot of people who are really terribly obese. And, you say, well, that's sedentary, but that's because of a sedentary lifestyle. But there's research being published recently that suggests that it's more than that.
Yeah.
So I don't bloody well know. But this whole gut bacteria thing also, this is an entirely new field of inquiry. No one had any idea about this. You have more bacteria in your body by cell count than cells.
10 to
human
1.
cells. 10 to 1. You're a walking ocean. And all those little creatures in there, they're producing all sorts of chemicals that are, in all probability, more conducive to their survival than to yours.
Right on.
So it's a new bottomless pit of mystery. And I'm definitely not saying this is a cure-all. I definitely not. But I know there's multiple pathways to depression. So maybe the idea would be, if you're depressed and you have a variety of autoimmune symptoms simultaneously, that you could tentatively consider that diet might play a role.
Michaela, good luck being normal.
Thank you.
It's really quite awesome. And it's great to see you smile.
Thanks.
Thank you both for coming back into TVO 4 years later and updating us on this really quite remarkable development. My
Thanks.
best to you both.
Yep.
Thank you.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.